tell me, what is dysautonomia?
It's a hot topic. Have you seen a burning building, but all you see is the smoke coming out of the windows? That is dysautonomia. I feel suicidal. I can't get out of bed. My life is totally collapsed since COVID. I don't know why. I feel horrible. It's a perfect storm. There are other things that are brewing underneath the surface, okay? Let's say Jake lives in a moldy house and you don't know it, and it's black mold and it's dangerous mold. Then all of a sudden you get a cut on your leg and get bacterial infection, and then you get COVID. And now you go into this state of sympathetic overdrive where, like I just said, bright lights are bothering you, sounds are bothering you.
Welcome to the Prince Health Podcast, where we guide you on a journey to vibrant health, greater clarity, and living your fullest life. I'm Jake Prince, and together with Dr. Ashley Prince, we will be your guide on this wellness journey. In each episode, we dive into practical strategies, expert insights, and inspiring stories to help you take ownership of your body, mind, and spirit. If you're ready to empower your health journey, gain clarity, and create lasting change, you're in the right place.
Hi, this is Jake Prince. Welcome. This is my best of me, my bride, Dr. Ashley Prince, here with Prince Health. What is dysautonomia? We have all these patients come into our clinic complaining and talking about headaches, fatigue, body aches. You know, they've been told they've been diagnosed with post-COVID symptoms, POTS, things of that nature. I mean, a lot of patients are complaining they can't get out of bed, they can't work, they can't be a mom, they want to be their kids, they can't be a wife, they desire to be to their husband, they can't work out, they can't function, they can't even get up and cook. They're saying make their family dinner. They're so fatigued, so tired, and have so many symptoms going on, struggling with migraines and headaches and things of that nature. So tell me, what is dysautonomia?
It's a hot topic. You know, have you seen a burning building and all you can see is the smoke coming out of the windows? But the fire is raging on the inside of the building and it's all encompassing and it's burning everyone up from the inside, but all you see is the smoke coming out of the windows. That is dysautonomia. You know, dysautonomia is a dysregulated nervous system. It is a nervous system that is on fire. It is also known as fight or flight. In infants, we can see it as colic, but essentially it is fight or flight. And nobody sees it, but you feel it very deeply.
So go back, tell me about when you're talking about smoke coming out of the building. What are you referring to there? Is that more like a symptom that potentially somebody's feeling, like a headache, chronic headaches, chronic migraines, chronic fatigue?
Well, you see
chronic brain fog.
You see it in our clinic. I mean, the beautiful women who come in their yoga pants and they look fit and fine and they look perfect on the outside, but there's a little something that you know is off. You can see in that, you know, maybe a little bit of anxiety, or maybe they look a little disheveled, but overall they look healthy. And then they come in and they start pouring out and they're telling me, I feel suicidal. I can't get out of bed. My life is totally collapsed since COVID, since I got this infection. I don't know why. I feel horrible, but yet they look okay. So the smoke coming out of the windows is really just that little something that you can tell is off. But dysautonomia is utterly life-changing. You know, it's a relatively new word, but I came across it in chiropractic school. And I'll never forget, there was a woman when I was in chiropractic school and doing my clinicals, there was a woman that came in with her baby. She just couldn't sleep. You know, her baby was crying all the time. And in medicine, we know that the definition of colic is a baby that cries 3 or more hours a night and you don't know why. And so here's this baby crying and crying and crying, and nobody can figure out why.
I'm just thinking of our own kids.
Yeah. Yeah, I was going to say, have you ever...
I have 3 kids. We know what crying is about.
Have you ever held a colicky baby? Have you ever met one? I mean, it's horrible. And usually the mother has no idea what to do. And to be honest with you, the doctors don't know what to do either. But the truth of it is, all it is a dysregulated nervous system. This baby has spent 9 months in the womb, in this beautiful, warm environment. All they hear is They hear the beautiful sounds of their mother's voice, and it sounds like, echoes from an orca whale. They feel this warm, gooey environment. The temperature is always steady. They don't, they see golden tones. That's what they see through the womb. And it's this comfortable refuge. And then all of a sudden, they're pulled out, with hundreds of pounds of pressure, with cold forceps. They see bright lights. They see weird hands, weird people coming at them. They're trying to slather, antibiotic ointment in their eyes. They're shooting them up with needles and vaccines. They're giving them all sorts of crap. And now this baby is utterly dysregulated. His nervous system can't control. His nervous system doesn't know what to do. He wants to go back to the womb, but they've ripped him out. And so what I learned in chiropractic was I felt so bad for this woman. I was like, I got to figure out a way to help her, like, how can we get this baby to calm down? And I took this class. It was like the 277 points of sleep hygiene. And it taught us how to basically create an environment for rest. And I learned, how do you get a baby to calm down? Well, you can get an adult to calm down with the same methods. We make the bedroom 75 degrees. We put a sound machine in the room that blocks out all the loud, abrupt noises. When the parents come in, they speak at a low tone. There's golden tones and not all these bright fluorescent lights. And we basically, in order to get babies to calm down, in order to get adults to calm down, we just recreate the womb on a daily basis. And it works. And in our clinic today, that's what all the crazy stuff we do. It's all with the hope and design to get the nervous system to calm down.
Yeah. No, that's good. Living in a culture where everything's so fast, coming at us in every direction, trying to keep up with everyone else. Like you're saying, just all the lights, the noise in life, just the noise of life, right, can affect our nervous system in our body. Which can affect the atmosphere in our body, right? And so going back to dysautonomia, like, how do people know if they have dysautonomia or not? And what are some more side effects of dysautonomia?
I mean, most people that come into our clinic, I would argue, they don't know they have dysautonomia. They will say things like, I feel like I'm about to explode, or they'll talk about having panic attacks, or they will say, all lights feel too bright, sounds feel too loud. I can't be around my children at dinner time. I mean, they don't know that they have this condition, but they know something's wrong. And I would say their husband can probably see smoke coming out of the windows. They don't see the fire that's lit on the inside, but everybody around sees the smoke coming out of the windows. They know something's off. You mentioned in your first question about POTS, because a lot of people will use those words kind of synonymously, and they'll say, well, I have dysautonomia and POTS. Well, it's important to know, number one, what causes dysautonomia, and then how does POTS happen? Because it's one thing after another. So there's essentially, a perfect storm that happens. There's a series of events that occurs to set the house on fire.
Tell me that. What are some events that could happen?
Well,
or storms that could happen to trigger the body to go into a kind of a place of where you have POTS or dysautonomia?
Well, all the doctors were saying COVID causes dysautonomia. And I say that's an utter lie. That's not true. POTS or COVID does not directly cause dysautonomia, or else, okay, I got dysautonomia after POTS, but you didn't. So why is that? We cannot make that claim. We cannot make the claim that COVID causes dysautonomia if not everyone that gets COVID has dysautonomia. What I've come to realize through clinical experience is that it's a perfect storm. There are other things that are brewing underneath the surface, okay? Like for you, let's say Jake lives in a moldy house and there's mold under your sink and you don't know it, and it's black mold and it's dangerous mold. Okay. And then let's just say your mom dies and you're going through a crisis and chaos in your heart and your spirit. And then all of a sudden you get a cut on your leg, while you're cowboying one day and you get bacterial infection and then you get COVID. And now you go into this state of sympathetic overdrive where, like I just said, bright lights are bothering you, sounds are bothering you. Well, what caused it? Was it COVID? Was it the bacterial infection? Was it the mold? What was it? Well, it was all of them together that created the perfect storm. And now something has peeked through.
Wow.
Something has broken the surface. And now your nervous system's going, alarm, alarm, alarm. The alarm is going off.
Mm-hmm.
Now Jake is in fight or flight and he has no idea how the hell to get out of it.
Wow. Yeah, that's good. So you're saying like, it's not just one thing, but it's multiple of things
Yes.
over time, over the years.
Yes.
Could have started at childhood,
Correct.
right? Trauma, whether, like maybe through a household, growing up in a household, or an atmosphere you're in that created trauma.
Yes.
Getting plagued with viruses, sickness, the flu, you name it, growing up. If you're an athlete, just overdoing it. We have a daughter that plays basketball, and they, them 2-a-day practices and going to school all day. I mean, greatly.
And it's too much for her.
Way too much.
But it's not for her teammates.
Yeah.
So why is that? Well, not every single one of her teammates has Lyme's disease. Not every single one of her teammates has gone through the things she's gone through. Yeah. So that's why dysautonomia is very individualized.
Yeah.
And it brings us back to, why is COVID? Because here's the thing, dysautonomia, I'm going to just call it fight or flight. Let's move into, it's just fight or flight. It has always been around. Ever since there's been sin, ever since there's been stress, ever since there's been, psychological turmoil, there's been fight or flight or dysregulated nervous systems. But why in 2020 was there all of a sudden this huge surge of it? Well, and this is my clinical hypothesis, is that actually what COVID does, what COVID is, I'm going to go into that, but how does it disrupt the nervous system the way it does? Well, what we found is there's this other little unknown virus that nobody talks about, and it's called Epstein-Barr virus. People are very common with mono. They know what mono is.
Yes, everybody you talk to has said at one time or another they've had mono, right?
Right.
I remember back when I was in like elementary school, nurse told me I had mono.
But mono's not a virus. Mono is a sequelae of symptoms. All it is, oh, I can see Jake's lymph nodes are swollen and Jake feels like poop and he doesn't want to get out of bed and he's fatigued. That's mono. That's the presentation. But the culprit, the enemy, the invader behind it is Epstein-Barr. And it's common. 95% of the American population has Epstein-Barr. What do you get it from? You get it from drinking out of a glass that's not totally clean at a restaurant. You get it from touching a doorknob, sitting on a dirty toilet seat. And now that pathogen gets into your body. And what people don't know about Epstein-Barr, so once again, Epstein-Barr is the pathogen, mono is the presentation, okay? But most people have Epstein-Barr, 95% of the population does, but it doesn't affect their immune system at all. Yeah. They're strong. But here's the thing. If the person has just gone through a death in the family, or they've had another bacterial infection in their leg, or they're in a moldy house, Epstein-Barr goes, this person's weak.
Perfect environment.
Correct. Perfect environment. This person's weak. I'm going to go ahead and I'm going to cause chaos right now. And in walks mono, the symptom presentation. But if the person is strong, what Epstein-Barr does is they do exactly this. They go, well, dang, this guy's strong. What can I do to him? I can't do anything. So Epstein-Barr climbs into the brainstem and hides. It's called a latent virus. These are the worst viruses that you can experience, are latent viruses, because they don't just come out, attack you for a week and then go, like the flu and like COVID. They come in and they set up shop and they wait in your brainstem for Jake to experience a moment of stress, a moment of illness, a moment of disease, and now they come out.
Kind of waiting for the perfect environment. When your immune system's down, your body's down, things have been compounding.
Waiting for the perfect storm.
Perfect storm, yeah.
And then here's the thing. COVID is the perfect storm. COVID is the tipping point. So what is the definition of long COVID is not really COVID. COVID has come in and created a stressful attack to reactivate or wake up the sleeping giant called Epstein-Barr virus. And now Epstein-Barr virus is awake. And he says, what can I mess with today? And his favorite spots are the thyroid gland. And that's where he will come in and he'll attack the thyroid gland and cause thyroid disease. He'll attack the brainstem and the tracts in the spinal cord, and he will cause MS. Epstein-Barr is the root cause of MS. Stop trying to cure MS. I mean, it is the root cause of MS.
MS is a symptom, but
Correct.
there's a root to that symptom, right? So a lot of things that people are being diagnosed with today and trying to treat from traditional medicine are actually symptoms, right? And they're being treated, they're trying to treat the symptoms as a root cause. And you're saying the root to a lot of causes could be Epstein-Barr.
It is.
Yeah.
Undoubtedly.
What are side effects of Epstein-Barr like?
You mean symptoms?
Symptoms.
Well, you know, once this virus comes in, if it's an all-out attack, the person will present with mono. Another thing they can present with would be thyroid disease because it loves the thyroid gland. The other place it loves is the acoustic nerve in the inner ear. It loves to come and sit on that nerve because that nerve vibrates. And it loves to sit on that nerve, and guess what? It causes tinnitus, or in Texas, tinnitus. It causes ringing in the ears. It causes dizziness, vertigo. And so people go to their ENT, and their ENT is like, oh yeah, you have Meniere's disease. No, you don't. You got Epstein-Barr virus attacking your acoustic nerve. Let's kill that guy.
Yeah, I mean, it reminds, I mean, I've seen it so much. People coming in. I used to run triathlons, marathons. We have professional athletes, Olympic athletes, business people, military, you name it, all walks of life. And they come in, they tell us, hey, I used to be able to do this, but I got sick. And ever since that sickness, I've never been able to recover. I've never been able to, been the same. And then doing testing, further testing and diagnosis, root cause testing, a lot of patients that have the symptoms that you're describing have Epstein-Barr virus.
And we have to remember 95% of the population has Epstein-Barr virus. But there's this increase in presenting with what I call a reactivation of Epstein-Barr. And that's where COVID comes in. So I just said, COVID, what it does is it reactivates Epstein-Barr virus. It is the perfect stressor. COVID, I guess this is the perfect time for me to tell everyone what it really is. We know COVID is not a virus. It's not. When you look at COVID under a microscope, it doesn't look anything like a virus. You will not find COVID in the Handbook of Virology, where every other virus on the planet is. The other virus you won't find in the Handbook of Virology is HIV/AIDS. Why is that not in there? Why are those two viruses patented? Can't patent a virus. What's up with that? Viruses cannot be patented. There's no other virus that's patented besides COVID-19 and HIV/AIDS. So let's just say COVID is a genetically modified pathogen. Let's just call it that. A GMP.
GMP, genetic modified pathogen.
Genetically modified pathogen. That's what I've been preaching from the beginning. Here's this form of a genetically modified pathogen. And when it was designed with an affinity for the nervous system. Okay, so what does that mean? Well, it means that when that pathogen comes into the body, it knows where to go. It was designed in a lab. Okay, the other thing about COVID that people don't realize is, so most viruses are, what will happen to them over time is they mutate. Okay, and so with COVID,
What's that mean when they mutate?
they change.
Are they changing throughout the body?
They're adapting to their
Adapting
environment.
to the environment.
Yeah, they're adapting to their environment. And so what's happened with COVID is it has rapidly mutated. People, all the doctors will say that. It rapidly mutates, which is why it's like nearly impossible to find a vaccine that actually like
Worse.
tames it
Yeah.
because it's so rapid at its mutation. Well, it's because it's not following the laws of virology. It's not mutating like a virus does because it's not a virus. It was created in a lab. And so when it was designed in the lab, it was designed with an affinity for the nervous system. But back in the days when COVID was being dispersed through the airways, it was different. Like Jake's coughing on Sammy, Sammy's sneezing on Jimmy, and you were passing COVID back and forth through respiratory droplets. And so that's why at that time, it worked great to do a nasopharyngeal swab, where they put it in there and they tickle your brain. That worked because COVID was passed through respiratory droplets. But nowadays it's not. It's passed through surfaces and door handles and dirty toilet seats. Once again, we even find it in vaginal secretions. COVID, when it first came out, I mean, that's why it was so rapidly spread. If I did a COVID test today, after presenting with COVID symptoms, it probably would be negative because I got it from a doorknob and I'm not able to test it with a nasopharyngeal swab. So here's the thing that people don't know and is very scary is that when it was designed in the lab, it's designed to go straight to the amygdala, which is the fear center part of the brain. As it transmits up into the brainstem, it can seed in the olfactory bulb, which is the taste and smell center part of the brain. It was designed to go there. It doesn't just arbitrarily go there. No, it has a direct command from the creator to go to that area, which is why thousands upon tens and thousands of people lose their taste and smell.
Yeah, I've noticed that since COVID. A lot of people, and we see a lot of patients too, that had COVID, could eat, taste, smell perfectly, never had a headache, migraine, able to do everything they love to do, hobbies, play with their kids, enjoy their work and things, got COVID, and boom, life just utterly changed for them, right?
Yeah.
They're experiencing, migraines, headaches, and, just an incredible margin of fatigue and tiredness, loss of taste and smell. Tendinitis you talk about, where COVID, you're saying, likes to hide within the nervous system there on the nerve, different things of that nature. And so they've never been the same since then. And then now you got, like you're saying, the perfect storm also with Epstein-Barr now able to really attack the body.
Well, yeah,
right?
because it's not
Post-COVID.
necessarily, because we've been talking about a burning building, COVID is the spark. COVID is the spark. And
It's not the root cause.
no,
COVID's
no,
not-
COVID is the spark.
It's just a virus,
Well, it's not a virus.
man-made virus,
It is a genetic,
man-made
a
pathogen.
GMP, genetically modified pathogen.
Mhm.
COVID is the spark,
Yeah.
and it's what turns on Epstein-Barr, and Epstein-Barr produces the flames.
Okay.
So Epstein-Barr is what causes the brain fog, the low energy, the low sex drive, the inability to fight off infections, the joint pain, the desiring to sleep all day, the depression. I mean, this is Epstein-Barr.
So Epstein-Barr, you're saying low sex drive. That's a big thing in America. Low energy, big thing in America. Probably all around the world, right? Chronic fatigue. And we hear this all day, every day. I don't care where you are. People are always struggling, fatigue. They're tired. I mean, you just go ask every kid, right?
Yeah.
They all struggle with fatigue and tiredness. I talk to so many moms, and there's like my kid, all they want to do is sleep all day. Headaches, migraines, all these things, fatigue, body aches. That's a big one.
Yeah.
Body aches. A lot of people nowadays are experiencing body aches like never before,
Yeah,
or feeling like they're just sick, like they had the flu, but they don't.
Right.
Like I feel sick. I feel like I had the flu, but I don't have a fever.
Well, here's the thing. The idiots or the doctors are testing. So the patient comes in and they feel sick. They say, I feel like I have the flu. I have body aches. I have no energy. I can't go to work. Okay. Like it's not the United States of lazy people. It's the United States of fatigued people because these people are tired. You know what I mean? And so they go to the doctor and the doctor's like, well, let me check you for the flu. Let me check you for strep. Let me check you up. You don't have COVID, strep, or the flu. You're fine. Go home. Well, here's what they need to do. They need to realize that Epstein-Barr can be reactivated. Yes, it's a latent virus. Yes, in medical school, you learned that your body produces antibodies to it and it's latent. But what these doctors need to realize, COVID has woke up a sleeping giant, which is Epstein-Barr, and we've got to now test for him. Maybe 30 years ago, we didn't need to test for him. Maybe 30 years ago, he was latent and he would stay sleeping, but not anymore. He's awake. And so we got to learn as doctors that if someone comes in with joint pain, fatigue, brain fog, we've got to test them for Epstein-Barr. And we've got to do a viral titer panel. We've got to look at what stage is the Epstein-Barr in, and we can tell if it's reactivated. And then most doctors don't know what to do if it is.
So if somebody is experiencing the symptoms you're talking about.
That you've said about 30 times, yes.
I've said a lot because I hear them every day.
I know.
You're saying number one thing's test for Epstein-Barr.
Correct.
Now, I can go to my, let's say, John Doe down the road, GP, and get an Epstein-Barr test. Now, is that as valid, or does it hold enough weight as, say, going through somebody like RG, DC, or somebody of that nature?
Well, you're thinking of Vibrant. So like in our clinic, you can do a viral titer. So let's just have a starting point. The starting point is doctors, you need to do a viral titer. You need to do an Epstein-Barr viral titer panel. And that will tell us what their numbers are. If it's reactivated, if the numbers are high, they need to go to a practitioner, probably a functional medicine doctor that treats Epstein-Barr virus regularly. And that, that's what we do in our clinic every day, is we treat Epstein-Barr by getting to the root cause of it and by killing the pathogen directly, which that's a whole nother podcast. But really, this is where the starting point is for this dysautonomia, is oftentimes the root cause of dysautonomia in our clinic, is there's the COVID, there's the mold, there's the stress, there's now the Epstein-Barr, and now this person's nervous system's like, look, I can't handle this, dude. Like, this is crazy. And so the patient comes in fight or flight. But here's the thing. This is where it gets difficult to treat. And this is why traditional medical doctors are kind of lost with people who have dysautonomia, is because they're like, I can't give them a medication for that. I have no medicine for that. I can give you Adderall and it'll give you energy. I can give you, Ritalin and it'll give you focus. But like, I really don't have a medicine to cure dysautonomia. And so because they don't have a medicine, they don't know what to do with them, or they deem them as crazy.
Crazy, yeah.
And they send them to a psychiatrist, which is the exact opposite direction you want to go, because then the psychiatrist puts them on all these other crazy meds that make things worse. Mm-hmm. But here's the thing, is the nervous system can only stay in fight or flight for so long. Now, you're strong. I don't think I've ever even seen you in fight or flight, but you're strong. Like, you could potentially, let's just say...
What is fight or flight for those that may not know?
Yeah, once again, it's dysautonomia. So
kind of share, like, what is it like when somebody's body is in fight or flight mode?
Yeah,
it's the way God designed it, our bodies, right?
Correct.
To be in a relaxed repair mode, right? Explain the difference there.
So once again, COVID can directly cause fight or flight or dysautonomia because it goes to the amygdala, or COVID can indirectly reactivate Epstein-Barr virus. And now Epstein-Barr virus is going, mold's going, and now we have this huge perfect storm, which now initiates fight or flight. Fight or flight is essentially what God put in our bodies to be able to run from a predator. You know what I mean? I mean, if a bear comes up to me, what's going to happen? My body's going to start dumping adrenaline. My pupils are going to dilate because I need to see far into the distance. I'm going to shunt blood to my legs because I got to run. I'm not going to feel like making love. I'm not going to feel like eating. I'm not going to feel like pooping right now. No, I'm focused on running and seeing into the distance. And so this is a really uncomfortable feeling when it doesn't stop. So imagine having your heart rate increase and shunting blood from your upper torso to your legs and never getting that blood getting that blood back.
Okay.
That's when POTS develops. Okay. So if we stay in fight or flight for too long, and everybody's different, that's the beauty of functional medicine, is we look at everybody as a different individualized person.
Yeah.
Okay.
Nothing's cookie cutter.
Correct. And
Everybody's
it can't be.
body heals differently, responds differently, heals differently.
Yes.
Yeah.
And we can never go back to the way things used to be. Now,
pre-COVID.
correct.
Okay.
Because nobody's nervous system is in rest and digest right now. Everybody has been touched by this thing that has disrupted the control panel as we know it. And the control panel is our nervous system.
Yeah.
It was designed to do that. It was a genetically modified pathogen to try to disrupt us and disrupt our nervous systems. And it's done that.
And on top of that, like, you have all the other sparks coming, giving fuel to the fire of, like, from the toxins, right? That we're embodied with every day, from the clothes we put on, you know, the products we put on our body, we wash with, our foods, the things we eat out of, we drink from.
And that's why these
There's
people,
just so much coming at us. And then you have COVID and all these different viruses and sicknesses continually trying to plague our body on top of it.
You know, that's why the people that come to see us, I'll never forget this woman, Brandy, who came in, and I walked into the exam room, and she's literally sitting Indian style on the ground. The lights are off in the room, and she's rocking like this. And she goes, Dr. Prince, can we please do the exam outside near those trees out there? You know, the trees I'm talking about. She wanted to go outside and do the exam. And I said, well, why? She goes, there's too many. I feel the energy in here. There's too many frequencies, you know? And that's what these people will feel. That's essentially what we're all feeling. I mean, there's frequencies happening all around us. Yes, the toxins from the food, like preach at RFK, like there's all sorts of crazy things that are touching us that didn't touch us 50 years ago. And so now we've got, you brought that up. Okay, look, we've got pathogens in the body, which didn't used to really hurt us.
Epstein-Barr.
Now we've got EMF frequencies that we never used to have before. We've got GMOs. We've got all these toxins that we didn't have 50 years ago. So how could we not be in fight or flight? And so like with you, let's say Jake is in fight or flight for a year. Let's say for a year straight, you're anxious. Your children's voices bother you. You just can't be around bright lights. You can't go into crowded places. You know, that's not anxiety. That's fight or flight. That's your body telling you something's wrong, Jake. Are you going to listen to me? But you keep shoving it down because you're a high performer. You're a high achiever. You run businesses. You minister to people. You take care of your family. You make money. You watch the stock. Like, you've got all this stuff going on. And so you don't listen to that little voice that's like, Jake, come on, man. Like, this is too much. We're in fight or flight here. And so the longer an individual ignores being in fight or flight, the more the flames are flaring.
So the smoke alarms are going off.
Correct.
What you're saying. The building's on fire, smoke's coming out, the smoke alarms are going off.
Yep,
Smoke
but you're
alarms could
ignoring
be
it. Jake's ignoring
anxiety,
them.
depression,
Yep.
overstimulation.
Jake's ignoring them. Or Susie with 6 kids and she's homeschooling them is ignoring them. And everyone's looking at her going, gosh, she's got smoke coming out of her ears. But Jake is ignoring them. And then all of a sudden one day, Jake gets up and he goes, whoa. I feel like my heart's beating a little too fast. Whoa, I can't really see very well. And boom, Jake hits the floor. What's that? That's called POTS.
Okay.
Now, Jake has ignored that voice inside of him. Jake's ignored his nervous system for a year. And now his central nervous system goes, hello, Jake. This is your central nervous system speaking. And I'm going to shut you down, boy, because I'm trying to save your
You
life.
just can't keep going.
Can't keep going that
Yeah.
way,
Okay.
or the fire will consume you.
Mhm.
So the central nervous system comes on, and now POTS develops. And POTS, we see it every day in our clinic.
Mhm. Tell us about POTS. It just seems like since COVID, I'm seeing so many more people with POTS or being diagnosed with POTS. They didn't
Mhm.
know they had POTS, right? And they just think they have these symptoms. And then, through further testing, like that being diagnosed with POTS. So tell us more about that. What is that?
Yeah, it's
What's
a
that look like?
pandemic, right now.
Especially among teenagers. I'm seeing
Teenagers,
a
really.
lot among teenagers.
And let's just go back to, here's this perfect storm. Here's the mold. Here's the Epstein-Barr. Here's the COVID. Here's the bacterial infection. It turns on the nervous system, and now we have dysautonomia. Dysautonomia has been happening for a year, and he's been in fight or flight, aka dysautonomia. He hasn't listened, and now all of a sudden the central nervous system turns on, and now we have POTS. So it's a this. POTS didn't just happen; it developed.
Developed over time.
Correct. And
Okay.
there is some genetic reasons that POTS can happen. Okay, like I'm not going to go into all that. I'm going into this, this flow, which is POTS essentially stands for Postural Orthostatic Tachycardia Syndrome, meaning when the person changes position, their heart rate goes flutter, flutter, flutter. They get an increase in heart rate.
Mhm.
Primarily when they go from laying to seated, and seated to standing, or they bend down to get clothes out of the washer, or, let's just say they're trying to play football, trying to make all sorts of passes. They can't do that anymore. Their heart rate goes through the roof. You get these young athletes out on the soccer field and they're passing out. They're dropping dead even
Yeah.
because their heart beats through their chest. And they can't do the things they used to do. Why? Because their heart rate's so high.
Mhm.
They feel like they're going to die or they pass out. So what POTS is, in basic terms, is in a normal human being, all of your blood flow stays from here up. Why? Well, because your heart needs blood flow, your lungs need blood flow, and of course your brain needs blood flow, right?
Mhm.
So with POTS, when the person stands up, all the blood flow goes down. Whoa. The blood flow drains down and the heart goes, oh crap. And it beats to bring the blood flow back up to the heart. Okay? So a normal person stands up and all the blood flow stays up. But when a person with POTS stands up, all the blood flow goes down. So this is the reason for them feeling faint, for them feeling dizzy, for them feeling brain fog. Oh, I just can't remember the things I used to. For them feeling depressed, for them feeling pain in their neck and their shoulders and having a headache. Why would you have a headache all the time, little Susie? Well, because I don't have any blood flow in my brain. Why would you have neck pain and shoulder pain? You look fine, Mrs. Smith. Well, gosh, I don't have any blood flow in my neck and my shoulders. It's all drained down. Why do I have crushing chest pain all the time? Well, because I don't have any blood flow in my lungs and my heart. It's all draining down to the bottom part of my torso. This is POTS.
Okay. So POTS, it's a growing, I like to call it a pandemic, right? Silent pandemic is what I like to call it. We're seeing a lot more of it. So how do you diagnose POTS? How do people know if they have POTS or not? Because I think a lot of symptoms you just talked about, I would say so many people can relate with that.
Everybody has them now. The thing is, there's a really simple way to diagnose POTS, and it's by simply taking, postural, checking the heart rate in a laying down position, a seated position, and a standing position. If there is a 25-point change, it's looking like POTS.
There's a good indication, yeah.
Yeah. Okay.
Okay.
And then if just general practitioners knew how to do those tests, which we all learn it in med school, if you learn how to do those tests, you could screen your patients for POTS. And then if there was a 25%, 25-point change, then you could refer them to a cardiologist who may or may not know how to treat POTS, but that's another
Yeah,
story.
there's probably very few that
Very
do.
few. But if they just did that simple screening test, they would go, oh my gosh, this person isn't having a heart attack. This person doesn't have just overwhelming tachycardia. This is POTS.
Mhm.
Then they could transfer them to a cardiologist and they could take over from there. But that is the best test. You know, once they get triaged to a cardiologist, that can hurt you or help you.
Yeah.
Because if you go to the wrong cardiologist, what they're going to do is they're going to put you on a Holter monitor, or they're going to check your heart rate, you know, by you wearing a Holter monitor. And unfortunately, that Holter monitor is not going to alert them that, okay, Jake just stood up. Jake just bent down. Jake just turned over. It just shows little transient points of tachycardia.
Mhm.
What needs to really come into play is there needs to be some sort of a device that could actually indicate if that person's changing positions. Then it could adequately diagnose POTS. Because what a cardiologist will do is they'll say, oh yeah, you had moments of tachycardia. I don't really know why. And they may or may not treat you for anything.
Okay.
But what they're usually going to give you is they're going to give you a blood pressure or a medicine to lower your heart rate, like propranolol. Let me tell you the problem with that. As a functional doctor that looks more at the root cause, I need to figure out what's causing this, not just giving them a medication to help them feel better. That's important to some people, but I need to figure out what's causing this. And if I can fix that, then the increased heart rate, all of that will go away. But unfortunately, what these cardiologists are now doing is they're giving them propranolol. Well, propranolol, what it does is it lowers the heart rate. Well, damn, that heart is beating fast to bring blood flow up to the upper torso. It's doing that on purpose. You can't override the heart. Well, they do. And now what we have is we have a child or an individual walking around feeling like they're not even here. I mean, they're just like, hello, because they have no blood flow to their brain. They have no blood flow. And they feel faint all the time. It doesn't help.
Okay.
Got to get to the root of the POTS, and then we can fix it.
Yeah. So, good point. I like what you said. I mean, a lot of people, good indication you have POTS is like when you're going up the stairs, you feel like you're going to faint, bend
Mhm.
over, you go do some sort of physical activity. Maybe just even rise up out of bed. Just you're laying flat and you just get up in the morning and you just feel like you're going to pass out, or you stand up out of bed, you feel like you're going to pass out. Anything to increase your heart rate. And then you start having all these symptoms that you're talking about. How can somebody that has POTS, how can they help substitute naturally, holistically, possibly?
I think it's really important to remember what the perfect storm is that's brewing underneath.
Mhm.
So going to someone that would be able to test for pathogens, test for toxins in the body, and then a doctor that could assess, is this person in fight or flight? And if they are, how do I get their nervous system to calm down? I think that those are the type of doctors these patients need to seek out instead of possibly, I don't want to say they shouldn't go to a cardiologist. I mean, you should,
Yeah.
but at the same time, we've got to find a group of new generation doctors that know how to calm down colicky babies, because we have a generation of colicky babies, and we got to get them to calm down, because it's kind of it's a two-edged sword. See, there's this concept of mitochondrial hibernation that occurs that a lot of doctors are talking about now, a lot of researchers are talking about. When the nervous system is so overwhelmed and the nervous system's in fight or flight, your mitochondria, which, Jake Prince, what are the mitochondria? Do you know?
No.
Okay. We usually learn it in high school biology. Your mitochondria are your powerhouses inside of your cells. They're what keep you going. And so they're what fight cancer. You want to see if somebody can fight cancer, look at their mitochondrial function. You want to see if somebody can be an Olympic athlete, look at their mitochondrial function. And so what happens when someone's body is in fight or flight for a year or whatever, the mitochondria say, hey, dude, I'm out. I'm going to go on vacation to Bora Bora. You take care of yourself. I'm hibernating. And the mitochondria turn inward and they begin to hibernate. It's almost like they're on strike. They're not going to work for you anymore. And when they do that, the immune system sees that. And the immune system goes, oh crap, what am I supposed to do? We got the nervous system going crazy. We got the mitochondria, they're on vacation. Like, what do I do? And now we get this chaos happening at an immune level. And now what ends up happening is we get pathogens that used to be pretty benign and pretty inconsequential, like Lyme. Everybody's got a little bit of Lyme in them. Everybody's got a little Epstein-Barr in them. But when the mitochondria go on strike and the immune system start freaking out, now we can't fight basic pathogens that are in the body. And now hidden bacteria like strep and Lyme come out of the woodwork and they go, oh yeah, this house is about to burn down. Now's the time for me to play because we've got a weak vessel.
Yeah.
And so we've got to take charge. If you want to know, is Epstein-Barr the root? Really, the way we could solve all of this is if we just simply got the nervous system to calm down. And if we could get the nervous system to calm down and then use permanent measures to kill off those pathogens, we've won the ultimate war. But that takes different types of doctors or a person that understands it all. And I hope that one day we will produce doctors that understand the body, like I just described, the mitochondria, the immune system, the nervous system. We got to have a doctor that understands all of these are playing together.
Yeah.
The old doctors, they only understand their craft. They understand cardiology. They understand neurology. They can't talk to you about something that's outside their scope. Those days are over. That cannot be the case. Post-COVID, those days are over. That's why people are leaving their doctors. And they're coming to people like me. I'm not an MD, but they're coming to me because I know more than these other doctors. Why? I'm just looking at the person as a whole. You're multiple systems under one roof. And we've got to see the way it's all connected, or else the house is going to burn down.
You're looking at the whole house.
Yeah.
Okay, so you got to get outside. You got to think outside the box.
You do now,
Not look for the
post-COVID,
symptom. Look what's underneath the symptoms.
or else you're never going to solve any of your patients' concerns.
Yeah.
And they're going to come to someone like me, and they're going to come to other people that are not doctors, because these people at least understand that the body is more than the sum of its parts. It is an entire ecosystem. And so
if people are wanting to get more to root cause of their symptoms, we talked about it a little earlier, what would you recommend them to go do?
I would definitely recommend them do some pathology testing, see what kind of foreign invaders are in their body. I would recommend that they do, if they're going to a GP, get a viral titer panel for Epstein-Barr. But more than anything, if smoke's coming out of the windows and the person is in fight or flight, there's a lot of ways to calm the nervous system down. And that's what we usually do first, in our clinic, is we are doing testing to see what's underneath. And at the same time, we're calming down the nervous system. We're calming down that colicky baby. And if we can get the nervous system to calm down, now the mitochondria will come out of hiding. The immune system goes, okay, I can fight this. I can fight that. I'm good. And we start to resolve the problem. So we have a lot of different techniques and tactics that we're doing, I know, in our clinic to calm the nervous system down. I think that's what we're good at.
Yeah, that's good. Kind of wrapping this up here, what are a few other things that you like to share with our audience or those who may be tuning in that are on this journey and they're really looking for help, and everywhere they go? I mean, we've been on it. We hear it every day. I've just been to doctor after doctor after doctor, and all they want to do is give me a lotion, potion, or pill. I take it, it doesn't work. And it's just dead end road after dead end road. They've been going down this journey for 5, 10, 15, 20, 30, 40 years. What do you have to say to them right now?
I would say first thing you need to do is take a drink of water. No, I mean, seriously, most people that are in fight or flight or they're chronically ill really just need an electrolyte. This was huge for me when I ended up in the psych ward. I ended up paralyzed. I mean, I had so many crazy things happening to me. I was totally, the house was burning. But most patients that come in, when we do a trial run of what's called fluid bolusing. And like, we give them a liter of Pedialyte one day, every morning. We say, before you get up out of bed, drink this liter of Pedialyte. Tastes like baby tears. And just drink that before you get up to start your day. What does that do? It increases your blood volume. So for somebody with POTS, or even somebody without POTS, somebody with dysautonomia or just immune dysregulation, Lyme disease or Epstein-Barr, mold toxicity, like, let's increase the blood volume. Okay. And so what that does is that essentially pushes everything upward. It pushes all the fluid volume upward. So we get more blood flow in the chest. We get more blood flow in the neck and the head. And so we immediately, within a week, these patients come in and they're like, wow, you fixed me. That's magic. It's like, no, it's just the design of the body. We put some water on the fire.
Yeah.
So we increase the blood volume and the headaches go away, the neck pain and the shoulder pain goes away, the brain fog goes away. And this is a temporary fix. Okay. It puts out the fire.
Okay.
But now we've got to figure out, well, was there a tear somewhere in the electrical circuitry? Like, we got to now figure out, how did the fire start? So essentially we put it out with the fluid bolusing for 1 week. We drink 1 liter of Pedialyte a day before getting out of bed. Then we do something called delta waves. Don't go, I always tell you, like, you have to be very careful what you listen to, especially with frequencies.
Yes, absolutely.
So frequencies are tricky. You can't just bring everything into your body. We talk heavily against PEMF, pulsed electromagnetic frequencies, EMFs, these beamer mats, all this stuff. It's too much for already a sympathetically driven body. But if we could do fluid bolusing, and if we could get somebody on proper delta waves, it would help put the fire out. And then we could work from there.
Thank you for listening to the Prince Health Podcast. We hope today's episode left you with clarity, practical guidance, and inspiration for your health journey. If you enjoyed today's conversation, be sure to subscribe so you never miss an episode and share it with someone who could benefit. Until next time, stay informed, stay empowered, and keep thriving.